to be able to nominate, in collaboration with Alan, for this amazing award. Alan is the glue that holds our infectious disease epidemiology program together. And in fact, it's a burgeoning program in the Division of Epidemiology and Community Health. But his passion is much more globally related. Alan has demonstrated by example the importance of global citizenship, and he values it so incredibly highly. He has represented the University of Minnesota at all levels, from national ministries of health to local rural villages and organizations of people with AIDS, helping to build bridges around the world, especially in sub-Saharan Africa. I wanted to share with you some of the quotes that came from the letters that were sent on behalf of Alan's nomination. Alan works very closely with the National Alliance of State and Territorial AIDS Directors. And in the letter, they stated, Alan clearly understands and embraces the notion that pure research in and of itself is not valuable unless it is tailored to the socio-cultural needs of the target population and can be scaled up and applied in the resource-constrained settings within which our partner health departments work. I want to share a quote from our my esteemed colleague Russell Lepker, who's here today. And by the way, I also want to acknowledge that our dean, Dean Finnegan, is here to also acknowledge and represent our school. But Russell said, Dr. Lifson is a major contributor to programs working to combat the AIDS epidemic and provide appropriate state-of-the-art treatments. This is not only a research and training contribution, but a humanitarian one of substantial impact on the public health of people living with HIV and AIDS. And Jim Neaton, who's here as well, who carries out clinical trials all over the world and is currently doing a clinical trial of the Ebola vaccine as we speak, said that over the last 6 to 7 years, Alan has made significant contributions to global education in HIV/AIDS through his work in rural Ethiopian villages. When the NIH organized a major treatment program in the South Africa Military Health Service, it was Alan who was asked to develop a similar program for review of AIDS outcomes and deaths from that research program. He not only implemented a similar system in this large South African research program, but he spent considerable time training people in South Africa on actually how to carry out this important task for their own research. And I also want to state that Alan has been instrumental in creating an environment, a safe environment for our own students who are pursuing international field experiences. He worked very closely with our program coordinator, Catherine Schwartz, who wrote a letter on his behalf. Alan and Catherine worked to create a more structure for the oversight of our students interested in international field experiences. And the work that Alan and Catherine did has really served as a model for the school in its entirety. Catherine wrote that working with Dr. Lifson over the past year has allowed me to see how deficient our previous procedures were. Prior to Dr. Lifson taking on this role, unless a student was traveling to a country on the State Department travel warning list, our students were not required to talk with anyone at the school level. And after implementation of this structured process, for the first time, at least in our division, students knew who to go to with concerns about a global field experience. And this was a huge achievement, not really for our division, but really for our school. And this program and structure that Alan and Catherine put together was adopted and implemented at the school level, and really has created a much safer and more structured environment for our students. And I should also say that Alan has been a recipient of a school-wide teaching award for his his amazing work in the classroom as well. So not only is he committed to education for global initiatives around the world, but he really is committed to education of our own students and creating opportunities for them around the world as well. And the last thing I wanted to say is that tomorrow, Alan is leaving to go to Liberia to help or to assist in creating a treatment facility for the treatment of Ebola. And he has recently undergone the CDC training for working with the virus. And I can't think of anyone more courageous than Alan to take on this initiative. And so with that, we have to raise our glasses and toast to Alan for the work that he plans to do in the future. May he travel safely. May he endure the 21-day period when he returns, and may he return safely to continue to work with our students and continue his work globally.
Thank you. Here, here.
Here, here.